You're listening to the PGX for Pharmacists podcast, part of the Pharmacy Podcast Network. Pharmacogenomics is the study of how genes affect a person's response to drugs. This revolutionary science combines pharmacology and genomics to develop effective, safe medications and doses that will be tailored to a person's genetic makeup. There's no better healthcare provider positioned to leverage the analytical power of pharmacogenomics to provide more effective medication therapies and outcomes than a clinical pharmacist. And now, here's the host of the PGX for Pharmacists podcast, pharmacist, researcher, and national pharmacogenetics expert, Ken Sternfeld.
Good afternoon, listeners. My name is Ken Sternfeld, and welcome to the Pharmacy Podcast Network. This is PGX for Pharmacists, and we thank you for dialing in. Please follow at Pharmacy Podcast and at PGX4RX for more information on the exciting things that go on the Pharmacy Podcast and specifically on PGX for Pharmacists. As I said, my name is Ken Sternfeld, and I am your host today. I am very, very excited to welcome three guests who I've had the opportunity to meet in person and spend a lot of time with over the last several months, as these gentlemen truly are changing the DNA of healthcare. They are working with pharmacists to increase adherence, which is the devil in our world of people not taking medications. So I'd like to invite three guests, Zach Negrelli, who's the Director of Operations, Matt Couillard, who's the Director of Consumer Relations, and Mark Drumney, who is the Director of Medication Management Services for a company called STAAR ALERT. STAAR ALERT helps patients manage the very complex medication schedules that they have through the use of automated medication devices. They also use 24/7 live operator monitoring to make sure that the patients take their medications, and this is managed by their life-saving monitoring center. They utilize proven medication management systems and protocols, and they help reduce the risk of anyone who misses their doses, and they help provide increased medication adherence. So as pharmacists, adherence is our biggest problem. So I'm pleased to welcome Zach, Matt, and Mark to the show. Gentlemen, welcome to PGX for Pharmacists.
Thanks for having us, Ken. We really appreciate being on here today.
Well, this is a first for me, having three guests on at one time. So I'm going to look to juggle the process and kind of direct some of the questions to individuals in the group who obviously their areas of specialty. So what I'd like to do first is ask Zach Negrelli, to kind of start out and give us, our listeners, a little bit about what STAAR Alert's solutions are and what the mission statement is for STAAR Alert and the things that they do. Zach?
Really appreciate it, Ken. I'm Zach. I'm the Director of Operations of STAAR Alert. And what really separates STAAR Alert from pretty much all the other companies out there is we are really passionate about keeping people aging place and independently in their home. The company was started in 1988 with the focus on helping keep people independent. And what we really focus on is making sure that people have the technology, tools, and the communication needed to keep them independent and healthy in their homes.
Well, that's wonderful, because if they're in their home, they're in a safe place. We're keeping them out of assisted living facilities where perhaps your solutions keep them from having to move to areas where others have to take care of them as their caregivers. So it's nice that what you're doing, it's so good for the patients to help them manage their medication, because adherence, as we mentioned, is such a challenge. And our industry does so many technology things that kind of connect the patient. But what you're doing is really a people piece. You're really connecting people to people so that the adherence to medication is enhanced. So Mark, as the Director of the Medication Management Services at STAAR, can you talk about adherence to the medications and some of the STAAR Alert solutions and, of course, some of your successes?
Sure, Ken, I'd be happy to. I wanted to start by saying two of the major reasons why people go on to the next level of care, for example, the nursing home or being admitted or readmitted to the hospital, is failure to adhere to their medications properly, or they fall. it's a very traumatic and expensive situation for the individual and their loved ones, and it's a national healthcare issue. So what STAAR Alert does is assist people to adhere to their medication regimens as prescribed by their physicians and pharmacists. STAAR Alert performs this by providing best-in-class medication dispensers in the home, 24/7 live monitoring of the devices from our Life Safety Monitoring Center. The medications dispensers are installed in the home and tested by STAAR Alert's bonded and trained personnel. Then the individualized medication dosing notifications are given with an audible or visual cue from the device. And if the medication is not taken within a half an hour, a friendly reminder call is made from our Life Safety Monitoring Center operators. With this equipment and service, STAAR Alert has become a leader in the medication equipment and adherence monitoring field, and our successes include documented higher adherence rates in the home setting to over 90% versus unknown. In the past, nobody knows how they're doing in the home. Now we know, and we can help them get up to that 90% level. And in addition, we have tracked medication persistent rates and lower hospital readmissions. Other successes we've had have been able to keep the clients remain at home, age in place, and be safe. This includes analysis of data from our Medicaid waiver program and life programs with clients. And these clients had chronic or multiple chronic conditions. And when they utilize the medication devices and monitoring, they've been able to stay in their home for over 667 days and climbing.
Wow. Those numbers are staggering. Not as much including the patient outcome and helping patients, but the lowering of the cost of healthcare is astronomical. Keeping people out of a hospital for 600 plus days. The impact that you make on the cost of healthcare and lowering the cost is, it's not just, hey, take your medication and stay healthy. You got to do that. But the lowering of the healthcare costs and keeping patients in environments that they're comfortable with, that they don't have to go back into a hospital. And you mentioned that you've increased it 90% with the devices that you use. I mean, I come out of the retail pharmacy space and can't tell you how many supervisor pharmacists came in and tell me how many text message people I got to sign up, so that they could be texted about their medication and, sync them up with things. And these are all important technologies. But what you're doing, I think, takes it to a higher ground, to a much more impactful and measurable level in how you are increasing adherence, which I keep saying is the devil of healthcare. So thank you for the things that you do with helping patients manage their medications.
Yeah, I think it's important to emphasize that in the past, when you leave the pharmacy and you go home, you don't know what they're doing. And now with our service and the 24/7 monitoring, you know if they're taking their medication or not and helping them be adherent. And the results of that are, like we just discussed, to stay longer in your home, age in place, be safe, be with your families and loved ones, and stay out of the next level of care or the hospital.
Wow. Sometimes working in retail pharmacy, the pharmacist doesn't know what's doing. It's so crazy, but I digress, and we're not going to go there. I want to talk to Zach again, if I might, because I took the time to visit your facility. I mean, you have a beautiful brochures and a great website, STAARalert.com. It gives anyone who goes there, we'll put that in the notes section so our listeners can go to the site. It really is a very, very comfortable place to learn about the services and the devices that you offer from leading companies to make this adherence solution work. But when I visited the facility, with our management team, we walked in and a nice receptionist welcomed us, and we walked into a beautiful reception area. And as soon as the door closed, it locked, like I was in in some high-level intelligence CIA or a place. It was wild. So I want to ask Zach, if he could, to talk about this life monitoring call center that you set up down in Munhall, Pennsylvania, which has won so many awards, and the things that you do down there in that call center. Zach?
Thanks, Ken. I'd be happy to talk about life safety monitoring, and it's really a place that we're truly proud of. We built it from the ground up with security and redundancy in mind for our customers. And what that means is we had Underwriters Laboratory come in, and they evaluate us on a monthly basis. And what they do is they check to make sure, hey, if the power goes out, if there is an emergency with the computers, that all of these customers will be monitored and will be safe. So we did things that other companies typically don't do. There is a steel roof on the building. There's 3 different phone carriers in case the phone carriers get cut out. We have backup generators in place. That way, if the power goes out, there will be a seamless transition, as well as redundant locations. So if something even happened to that facility, that our customers would be backed up and protected. So we did a top-down approach, looking at everything to make sure that we could keep our customers protected, and that if they're ever having any trouble with their medication or medication regimen, that they're going to be reminded to make sure that they take their medicine on time. A couple of really neat awards that we have recently gotten is the Monitoring Association has a certification called 5 Diamond Certification. And what that is you have to take all of the operators at that building, as well as shift managers and managers, to take this course so that they can comply with level 1 and 2 of the Monitoring Association training. And we ended up getting a 5 Diamond Certification Award. And there's less than 150 monitoring stations in the whole world that have received that honor. So besides being a UL listed facility where we get monitored once a month, they come in and check to make sure that we are staying compliant with all of our backups. All of these operators have been tested and trained to 5 Diamond certification to keep our customers safe.
Wow. Congratulations on it. It's kind of like the Academy Award of your business model. So kudos to the entire team. And I had a chance to meet some of those team members and those call people doing those calls and speaking directly. We had, I guess, the director of your call center come in and show us how the alerts come through. And I felt very protected and very safe in that environment. So it's interesting as a pharmacist to see the addition of having someone who has medication knowledge like we do could be part of that call communication coordination process. So we feel there's a great synergy with STAAR Alert and the things that pharmacists who want to do things out of the box and help patients can do. And we'll talk more about that later and on other shows about how every pharmacist listening can get involved with STAAR Alert. Every pharmacist can meet in a physician's office with patients and show them that great product and great service that you guys have available. So speaking of the product, I'm going to like to say hi to Matt, because Matt and I work together very closely as we looked at the product. It was a product from a company in Israel called Vika, and it was clearly the most flagship, comprehensive adherence product I have ever seen in my life. And we were fortunate enough to put a press release together with STAAR Alert and Vika about their product. So, Matt, welcome again. Can you tell us a little bit about the Vika flagship product and how you use it and others to keep the patients, on track with the medications that they are prescribed? Matt?
Sure. Yeah, thanks again, Ken. So exactly, the Vika Simple Med is a tool we use to assist with, really our 2 goals are delivering the right medication at the right time. So delivering the right medication at the right time, once that patient goes home, after the pharmacist evaluates, the physician prescribes the medicine, the Vika will hold the medication, keeps it organized for them by dose. And then at the prescribed dosing time, it is going to remind the patient. It produces an audible alarm as well as it flashes a light. So there are a couple different ways that the patient, once they're in the home, are going to be notified. And they have a certain time window to access their dose. If they don't take it within a certain amount of time, that's really where everything we've been talking about with the monitoring station, where that really comes into play. So if they don't take their medicine, we have live intervention, follow-up, and reminders provided by our staff just to make sure that that patient is taking the medicine in that prescribed time window. And really what kind of ties it all together is not only the real-time monitoring that occurs, but also the reporting that can be provided to the pharmacist, to the physician, caregivers, really whoever's kind of in that patient's circle of care can go back and look at historical data. So you can look at their weekly adherence, their monthly adherence, kind of look at a 4-month snapshot, and really kind of start to connect the dots on maybe where some gaps in adherence are occurring. Are they, consistently missing their, Wednesday evening dose? Well, why is that? Or are they, missing one particular dose? Well, maybe there's a medication in there that they don't want to take. And so it kind of gives you a very detailed look into that patient's habits and really gives us a very clear picture of what the actual patient's adherence is.
Well, you're really raising awareness to what we all know is the issue. I took one of these products and I loaded up my own medications. And traditionally, healthcare providers are the worst adherence people. I don't take my medication like I should. So I get those reports and I get these, and they are more than simple reminders. They are truly the pathway to better health. And to have that information and then be able to share it with my physician to say, listen, you don't need to increase my dose. I'm just not taking it the right way. I just have to be better. And you've helped us, your team has helped us understand that there are additional services for remote patient monitoring, that these products that you offer allow a pharmacist to actually engage with a physician and make money. We're not going to get into all of that today because we're going to do a special separate webinar for our PGX for Pharmacists listeners just on STAAR Alert and just on the financial ability for them to make money by being concierge service providers and utilizing the STAAR Alert product. I want to ask, Zach has been great in helping us put together on the website some information that our pharmacists can look at. And I mentioned we're going to put it into the notes section. But there are other products, and we always like to joke, I fell and I can't get up and, all those things you see on TV. But the breadth of your product, it goes much further than medication management, which, of course, we're interested in because we're pharmacists. But the cost of people falling and the challenges of people as they get older and having caregivers who have to be wareful of what's going on, you're really doing major, major work in the personal emergency remote monitoring systems as well. And all of those products are available for pharmacists to engage with their patients. So, Zach, can you talk a little bit about how you position the STAAR product on your website and some of the things that are offered there?
I'd be happy to, Ken. So STAAR Alert, our website, www.STAARALERT.com, primarily when we started over 30 years ago, was as an emergency response company. And while you did mention there's commercials out there like the I've fallen and I can't get up button, we really kind of take it in a different way, as it being a security alarm, not only just to get help from an ambulance, but it also can be used to get a hold of the police in case of home invasion, the fire department in case there's a fire, as well as family members or neighbors if it's a non-medical emergency. And we've seen these devices help tens of thousands of customers just on a day-to-day basis without having to worry about getting an ambulance or people being able to get a hold of family members. Truly, I think that it's really a big thing about security and not so much as, hey, this is a device used just if somebody has a fall or other emergency. We've had people from as young as 14 years old get these systems from when they left hospitals, to also grandchildren being able to press the button to help save their grandparents while they were visiting. So these devices are truly unique in being able to keep people independent in their home and give people the appropriate type of help, whether that is an ambulance, the police, or the fire department.
Great. I think I have a client for you. Working in retail pharmacy, I think every pharmacist or technician should wear one of these things, because running around the way they do in retail, I've seen too many people fall running to the drive-through window, trying to get to it before the buzzer rang. But I digress. I'm sorry. It happens sometimes when you spend time in retail. But anyway, The STAAR Alert relationship with RxVIP is something I'm very proud of because you've recognized the value of a pharmacist. And, that's a good thing in our profession. As you know, this show is called PGX for Pharmacists. So, the founder and publisher kind of makes me say, hey, you got to talk a little bit about pharmacogenetics because that's tomorrow's medicine today. And we love it. So I'm going to ask each of you, well, let's start with Mark, because Mark, you're the medication management director. Just, personally, I know STAAR Alert doesn't, reduce adverse drug reactions, but what's your perspective on pharmacogenetics and its impact on the medical profession, which you've been in for quite some time?
Sure, Ken, but before I do that, we talked about the relationship between RxVIP and STAAR Alert, and we've been working together, and it's been very enjoyable, and I think we're going to carve new pathways for pharmacists to become an more integrated, important part of taking care of people in their home. So I look forward to doing that with you and everybody else listening.
Thank you for that comment, and we love working with you. And the students, which are the next generation, we believe are going to be the stars of the future who are going to do this kind of patient-centric care. So I thank you for that comment.
Yeah, and also, in addition, I know that you and Zach have been working hard on providing a website where people can learn about our products and what we're doing together and train and be part of the care team. Then my perspective on PGX and how it impacts patient care and medication management is simple but clear. To have effective medication therapy, you have to have the right medication at the right dose at the right time. With PGX testing, for me, it means that the medication dosing can be individualized for the consumer with the assistance of the pharmacist. And whether you're a child, teen, adult, or senior adult, you're getting the right strength and what's individualized for you. And I think that's key. And then where STAAR Alert fits is that we can assist taking the medication at the right dosing period and provide minor reminders if you don't.
Wow. I'll tell you, if I could package that little comment and speech up and say it to every pharmacist and every medical profession out there, you really, if the things don't, between us, if the things don't work out over there, you can always be our director of medication management. I'm just kidding. You're wonderful. Thank you. Thank you so much for those words. They really resonate with what we're trying to do, which is align proper medication management and adherence to the right drug that the patient should be taking based on the genetic profile. So thank you for putting that into such simple words for our listeners. We're coming to the end of our segment. And again, I hope this is not the only segment we do. I look forward to more conversations always with you gentlemen. You're pleasures to work with, and we've learned a lot by collaborating with you. At the end, I'd like Zach to kind of, if he could, talk about the future, talk about the vision. Where STAAR is today is as a leader. You're the leading entity in your market sector. What is the vision for STAAR Alert, and where do you see your vision of your company going?
I'd say that for the future, really, it's going to be maintaining on the principles of our mission statement. Our goal is always going to be to use technology to help people age in place. So while the products may change in the emergency response field and for medication management, our mission is still going to be to provide great service for our customers, provide in-home education and training on the equipment, provide world-class monitoring, and then also to provide the best up-to-date technology to help keep people independent and aging in place. While I might not know exactly what that technology might look like, we do know that those are our missions and what we want to do and help people age in place in the future.
That's wonderful. And none of us know what the technology is going to be, but I'm a big believer that healthcare is about the people, and the people who I've met at STAAR Alert are committed to patient-centric care and excellence in that area. So healthcare is about people and connecting those people to providers who can deliver the things that they need to keep them healthy. So my vision, for our relationship is 300 pounds soaking wet for those people who know me, I want to find a way to put a pharmacist in the box of a STAAR Alert product so that we could be there to offer the medication consultations to patients who purchase your product and utilize your product in all areas that you do. Because I think adding a pharmacist to that adherence flagship product is a game changer. So we're going to look for, absolutely, we've already got some solutions that we've talked about as a team. We're going to have other calls and other presentations to our listeners. STAAR Alert is a critically important part of a pharmacist's life going forward if you want to deliver patient care. So I thank you, gentlemen. If you want to send over any notes that you want us to put in, anything about your company, we'll put them in the bottom notes of the podcast. Of course, your social media, if you have Twitter handles, but everyone can follow at PGX4RX, and of course, always follow at Pharmacy Podcast, because the hosts there on this show have extraordinary topics to talk about. So I want to thank our guests, and I want to thank our listeners, because without you, we don't have much to do. So have a wonderful day. This is Ken Sternfeld for PGX for Pharmacists, and I hope you all have a wonderful day. Thank you.